Hello, I'm Vipul Patel. I'm founder of the International Prostate Cancer Foundation. I'm a urologist and a surgeon in urologic oncology. And after 10 years of taking care of patients with prostate cancer, we decided that it was time to give back beyond what we do on a daily basis. So based upon that, we formed the International Prostate Cancer Foundation. It's a unique foundation because it's really run and led by physicians and patients who've had the disease. And I think that makes us somewhat unique compared to other foundations. Our goals are very strong, and they're also global initiatives, and initiatives that will take many years to accomplish. We understand that. However, we've built a team of experts on our board and collaborators who are there to help us succeed in our goals. I really think that the foundation was inspired by the patients that we've taken care of over the last decade. Of a total of almost 5,000 patients we've helped with prostate cancer. And it's because of these 5,000 patients that we've learned so much about the disease, but also what's needed by people who have the disease now and who will have it in the future. As we all know, prostate cancer is the most common cancer in males. It's the most common reason for death. It's actually more common than breast cancer. However, many people don't know about it, and many males don't know that screening is necessary once you became age 40. For men, once they reach the age of 40, they should be offered screening, and screening would include a PSA test, which is a simple blood test, and a digital rectal exam, and that will be done yearly. If patients have a family history of prostate cancer where their uncle or brother or some other relative has prostate cancer, then their risk would be increased, and obviously we would follow them closely. Based upon these things, the goals of our foundation were created. One is genetic testing. We're really interested in looking at the genetics of the disease and seeing if we can identify certain genetic factors that predispose someone to getting it, and maybe find the genetics of the cancer of people that already have the cancer and use some medication to manipulate that and cure them. The second is education, working with physicians and patients to educate them about curing the disease or about their surgical options. I think for patients, it's very, very important to have knowledge of the disease and their surgical and non-surgical options once they have the disease. And I think if our foundation can create a way where patients can be aware of the different modalities of treatment and also awareness of screening, I think we've done a great job. Educating physicians is also important when it comes to prostate cancer, and that's one of the key goals of our foundation. And above that, education and research. I think working with universities around the world, we should be able to contribute back to the academics, providing funding for research, and beyond that, allowing us to cure the disease or help at least alleviate some portion of its burden. So that's really the goals of our foundation. I'd like to thank all of our board members who spent a lot of time working with us, and we invite all of you listening to this video, looking at our site, to contact us for further help and for further questions. Thank you.